Hi, my name's Oscar Colegio, and I'm the Chief of Dermatology at Roswell Park Comprehensive Cancer Center. So I'm originally from Texas, born in Texas, and went to college at the University of Texas at Austin, where I studied pharmacy. And from that point, then I moved to New Haven, Connecticut, where I attended Yale University Medical School, as well as graduate school. So I was enrolled in their medical scientist training program, and over the course of 8 years, completed an MD degree and a PhD degree. I've always been fascinated by the use of pharmaceuticals in the treatment of disease, but became more interested in interacting with people on a day-to-day basis in the context of the doctor-patient relationship. And so becoming interested in that, I then chose to go to medical school. And through medical school then discovered that the patients that I was most interested, the people I was most interested in taking care of were those who had conditions that manifested on the skin. And therefore, after medical school, I completed an internship in internal medicine and a residency in dermatology. I think that if somebody is, first of all, concerned that there's something on their skin that doesn't quite, that is new and that's concerning to them, that alone is reason enough for approaching Roswell, because that very well may represent a skin cancer. And then by physical examination, we may determine that it's something that's benign but growing, or something that is more along the lines of a skin cancer. I think what makes Roswell unique is that here assembled is a team that works together on a daily basis of physicians, as well physicians who examine the skin, who may do biopsies of skin if indicated, or treat medically if indicated. And then if it turns out a skin cancer is diagnosed, highly trained skin surgeons who can treat the skin cancers, and dermatopathologists. Those are pathologists who are very focused in their clinical practice looking at biopsies and excisions of the skin. We hold conferences together as a group, the medical dermatologists, the surgical dermatologists, and the pathologists, so that patients get coordinated care across a broad spectrum of subspecialties within dermatology. What I love to do for fun typically is to run, and I've found Buffalo to be quite an amazing running town, in particular during this season when the sun is late to rise and early to bed. There are an amazing number of night runners that run the streets of Buffalo in either dry conditions or snowy conditions. So I found camaraderie running before work among a lot of people up in the neighborhood where I live.